1. Which strategy best supports orientation training for adult learners in a clinical setting? A. Passive lecture-based instruction. B. Visual timelines and hands-on simulations. C. Frequent written assessments. D. Pre-recorded webinars with minimal interaction. 2. What is the primary purpose of abstraction testing in cognitive assessments like MoCA? A. To assess language comprehension. B. To evaluate simple arithmetic. C. To measure conceptual thinking and cognitive flexibility. D. To determine spatial orientation only. 3. How should a mentor use the MoCA orientation section results when coaching a new healthcare assistant? A. Ignore results and use intuition. B. Focus solely on technical skills. C. Customize orientation schedules to cognitive strengths and gaps. D. Provide the same materials for all ments. 4. An effective orientation module must align with which adult learning principle? A. Authority-driven teaching. B. Content memorization. C. Relevance to real-life experiences. D. Repetition without context. 5. In the MoCA test, abstraction questions often use analogy. Which technique best improves abstraction skills in adult learners? A. Crossword puzzles. B. Role-playing scenarios. C. Memorizing vocabulary. D. Watching documentaries. 6. Which method most effectively evaluates abstraction capabilities in adult learners within a clinical curriculum? A. Multiple choice knowledge tests. B. Real-time case study analysis. C. Peer evaluations. D. Automated online quizzes. 7. When reviewing orientation outcomes, which metric best reflects effective adult learning? A. Time spent on training. B. Post-training behavioral performance. C. Attendance rates. D. Number of slides viewed. 8. Why is orientation critical in assessing regulatory compliance? A. It replaces certification. B. It avoids documentation requirements. C. It ensures staff understand protocols and responsibilities. D. It limits administrative oversight. 9. In abstraction assessment, analogical reasoning primarily evaluates A. Emotional intelligence. B. Executive function and verbal reasoning. C. Gross motor skills. D. Mathematical fluency. 10. Which approach ensures the abstraction portion of a curriculum promotes long-term cognitive development? A. Short-term memorization tasks. B. Repetitive audio lessons. C. Guided group discussion using metaphors and analogies. D. Rote learning of terms. 11. Orientation programs are most effective when they A. Assume prior knowledge. B. Avoid feedback loops. C. Address diverse cognitive baselines. D. Use a single delivery format. 12. What is a recommended way to integrate abstraction tasks in adult education for healthcare workers? A. Abstract drawing exercises. B. Matching symbols and shapes. C. Clinical analogies linking symptoms and diagnoses. D. Speed reading contests. 13. A new policy requires evaluating abstraction ability in older adults. Which adaptation is most ethical and compliant? A. Provide no accommodations. B. Simplify instructions and extend time limits. C. Eliminate difficult items. D. Skip the abstraction component. 14. In MoCA, the abstraction task often asks the participant to identify similarities. This promotes A. Discrete memory retrieval. B. Conceptual generalization. C. Physical coordination. D. Emotional recall. 15. An effective orientation strategy for abstract reasoning includes A. Providing complex case scenarios for team discussion. B. Forcing memorization of abstract terms. C. Encouraging isolated study without support. D. Avoiding hypothetical reasoning. 16. The abstraction portion of MoCA can assist curriculum developers by A. Replacing all assessments. B. Informing the pacing and cognitive challenge level. C. Measuring physical stamina. D. Verifying previous degrees. 17. Orientation sessions should include which component to support adult learners with lower abstraction scores? A. Complex policies with legal jargon. B. Multiple choice tests only. C. Contextual walkthroughs of workplace settings. D. Redundant documents. 18. Which abstraction activity best aligns with adult learning principles and mentoring? A. Daily quizzes on definitions. B. Paired comparison of patient cases. C. Listening to monotone lectures. D. Copying regulatory manuals by hand. 19. Which evaluation method best measures orientation success in abstraction training? A. Self-reported stress scores. B. Summative recall assessments. C. Structured observation during clinical simulations. D. Hours of completed coursework. 20. Which communication technique enhances understanding during orientation? A. One-directional speech. B. Open-ended dialogue and analogies. C. Use of only printed materials. D. Avoiding learner questions. 21. Mentoring strategies to develop abstraction skills should prioritize A. Daily written tests. B. Immediate correction of errors only. C. Encouraging pattern recognition in clinical settings. D. Avoiding case-based learning. 22. Orientation failures in abstraction tasks may suggest A. Poor sleep. B. A need for reevaluation of instructional methods. C. Inadequate handwriting. D. Disinterest in policy. 23. Which regulatory guideline impacts the delivery of orientation training in healthcare settings? A. HIPAA. B. OSHA. C. Both A and B. D. Neither A nor B. 24. Abstract thinking in adult education is best nurtured through A. Flashcards. B. Real-world problem-solving scenarios. C. Multiple lectures per day. D. Scheduled memorization. 25. The abstraction component of the MoCA test supports mentors by identifying A. aptitude and motor skills. B. Learner emotional needs. C. Conceptual reasoning ability. D. Academic background. 26. In adult education, how does abstraction training support workplace performance? A. It strengthens vocabulary skills only. B. It fosters critical thinking and adaptability. C. It replaces standard protocols. D. It eliminates the need for compliance training. 27. When designing orientation materials to support abstraction, what is most effective? A. Text-heavy manuals. B. Unstructured group chats. C. Memorization of rules. D. Scenario-based learning with analogical reasoning. 28. In a mentoring context, abstraction training should focus on A. Repetition of information. B. Compliance documentation. C. Synthesizing new ideas from known concepts. D. Isolated knowledge tests. 29. Which curriculum strategy best promotes abstraction development in adult learners? A. Linear content delivery with quizzes. B. Spiral learning with increasingly complex concepts. C. Lecture-only approach. D. Independent reading assignments. 30. Regulatory compliance training benefits from abstract reasoning by A. Reducing documentation needs. B. Promoting generalization of safety protocols across scenarios. C. Avoiding learner feedback. D. Focusing solely on penalties. 31. A new nurse struggles with MoCA abstraction items. As a mentor, what's the best support? A. Penalize incorrect answers. B. Ignore and proceed. C. Reinforce analogical thinking through clinical parallels. D. Replace training with observation only. 32. Which method best measures improvement in abstraction after orientation? A. Completion of an attendance log. B. Written evaluation of analogical case scenarios. C. Verbal memory testing. D. Time spent in sessions. 33. Abstraction in healthcare orientation most directly supports which competency? A. Clinical decision-making. B. Manual dexterity. C. Physical assessment. D. Record-keeping. 34. What best describes a learner-centered abstraction strategy? A. Uniform content for all. B. Flexible activities based on learner backgrounds. C. Testing before instruction. D. Lecture-heavy modules. 35. Which tool is most effective in fostering abstract reasoning during orientation? A. Checklists. B. Slide decks. C. Clinical storytelling. D. Attendance sheets. 36. Which adult learning theory most supports teaching abstract concepts in orientation? A. Behaviorism. B. Constructivism. C. Humanism. D. Classical conditioning. 37. A strong abstraction score on MoCA suggests A. Limited cognitive range. B. High potential for synthesizing new information. C. Poor social functioning. D. Weak long-term memory. 38. What can abstraction tasks reveal in a clinical mentee? A. Handwriting speed. B. Interpersonal communication skill. C. Conceptual clarity and pattern recognition. D. Time management habits. 39. Orientation feedback for abstraction tasks should include A. Only negative critique. B. Open-ended suggestions and supportive analogies. C. Mandatory retesting. D. Legal references. 40. Which scenario promotes abstraction skill building in orientation? A. Matching acronyms. B. Repeating memorized rules. C. Comparing diverse patient presentations. D. Watching silent videos. 41. What is the cognitive focus of the abstraction test within MoCA? A. Spatial recognition. B. Short-term memory. C. Logical association between concepts. D. Mathematical calculation. 42. Which abstraction task is most appropriate for a nurse mentor to use? A. Listing medication names. B. Demonstrating blood pressure technique. C. Identifying connections between patient symptoms. D. Transcribing policy documents. 43. Which outcome best indicates successful abstraction training in a regulated setting? A. High retention of analogies and applications. B. Perfect attendance. C. Faster reading of manuals. D. Reduction in training hours. 44. Abstraction development is most enhanced by A. Written quizzes. B. Collaborative problem-solving exercises. C. Compliance audits. D. Procedural videos. 45. Which adult learning feature is crucial when integrating abstraction into curriculum? A. Relevance to workplace experience. B. Simplification of all content. C. Avoidance of discussions. D. Single format delivery. 46. The abstraction portion of the MoCA evaluates which skill? A. Technical compliance. B. Emotional stability. C. Conceptual and relational thinking. D. Motor planning. 47. A healthcare educator can measure abstraction skill development through A. Attendance rates. B. Time tracking logs. C. Clinical scenario analysis. D. Passive listening assessments. 48. In curriculum design, abstraction-based modules should A. Be optional. B. Focus on trivia. C. Include pattern and analogy-based assessments. D. Rely solely on lecture. 49. For regulatory training, abstraction skills ensure A. Literal rule memorization only. B. Adaptive application of complex standards. C. Elimination of policy use. D. Avoidance of professional judgment. 50. Which principle best aligns with abstraction-focused adult learning? A. Immediate relevance and application. B. Passive content delivery. C. Randomized assessments. D. High-pressure timed tests. 51. When using MoCA abstraction results for mentoring, what is essential? A. Using them to disqualify learners. B. Adjusting instruction to build concept connections. C. Avoiding difficult content. D. Switching to written policy handouts. 52. Which is a direct benefit of high abstraction scores for healthcare professionals? A. Better patient empathy. B. Faster charting. C. Stronger clinical reasoning and decision-making. D. Higher staff retention. 53. In orientation, abstraction tasks should be A. Highly technical. B. Linked to real-world situations. C. Avoided due to difficulty. D. Limited to visual learners. 54. Which approach best supports abstraction for ESL adult learners? A. Clear analogies with visual support. B. Only English lectures. C. Monolingual reading materials. D. Unmodified policy texts. 55. Curriculum that emphasizes abstraction is more likely to result in A. Confusion and dropout. B. Superficial knowledge. C. Long-term cognitive adaptability. D. High anxiety levels. 56. How can abstraction training reduce medical errors? A. Through repetitive memorization. B. By promoting adaptive pattern recognition. C. By reducing engagement. D. By removing variability. 57. When implementing MoCA abstraction tasks into training, instructors should A. Provide rigid grading rubrics. B. Facilitate discussion around analogical meaning. C. Avoid learner feedback. D. Simplify language excessively. 58. A newly hired clinician scores low on abstraction. How should a mentor respond? A. Design tailored analogical learning experiences. B. Refer for dismissal. C. Repeat orientation in full. D. Ignore and proceed. 59. In abstraction evaluation, which technique is most supportive of adult learning? A. Closed book testing. B. Interactive simulations. C. Handwriting drills. D. Passive e-learning. 60. How does abstraction relate to regulatory training outcomes? A. It ensures compliance through rote knowledge. B. It enables flexible application of complex protocols. C. It reduces the need for documentation. D. It simplifies all concepts equally. 61. What instructional strategy supports abstraction in a diverse adult learning group? A. One-size-fits-all worksheets. B. Multifaceted case analysis and discussion. C. Timed memorization contests. D. Mandatory silent reading. 62. An abstract reasoning deficit in orientation could be supported through A. Immediate reassignment. B. Simplified real-world analogies and practice. C. Accelerated online modules. D. Peer grading. 63. Which of the following best demonstrates abstraction in action? A. Copying notes from a manual. B. Recognizing the commonality between inflammation and infection responses. C. Listing symptoms of diabetes. D. Typing policy notes verbatim. 64. How does abstraction enhance patient-centered care and training? A. Reduces need for case interpretation. B. Increases emotional burnout. C. Encourages holistic problem solving. D. Avoids ambiguity. 65. A well-designed abstraction training module should include A. Time trials and competition. B. Concept linking exercises using real scenarios. C. Focus on individual test scores. D. Emphasis on unrelated analogies. 66. Which feedback style best supports abstraction development in adult learners? A. Binary right-wrong. B. Lecture-only review. C. Guided self-reflection and group discussion. D. Audio-only feedback. 67. A healthcare trainer includes analogy-based assessments. This promotes A. Rote memorization. B. Compliance fatigue. C. Conceptual generalization. D. Policy rewriting. 68. Why include abstraction in an orientation test battery? A. To eliminate lower-performing learners. B. To assess readiness for complex reasoning tasks. C. To replace communication training. D. To fulfill a bureaucratic requirement. 69. How does abstraction training contribute to improved communication? A. By clarifying relationships between complex ideas. B. By replacing conversation with visuals. C. By removing ambiguity from all speech. D. By prioritizing jargon. 70. The MoCA abstraction section is most useful in A. Tracking gross motor development. B. Determining vocabulary range. C. Assessing cognitive ability to relate concepts. D. Measuring compliance speed. 71. During orientation, abstraction can be encouraged by A. Assigning vocabulary lists. B. Exploring multiple diagnoses for a single symptom. C. Emphasizing exact memorization of policies. D. Enforcing uniform procedures. 72. What is the key role of abstraction in adult learning for health professionals? A. Improving memorization speed. B. Promoting deeper understanding through conceptual linking. C. Avoiding clinical reasoning. D. Teaching organizational charts. 73. An abstraction activity asking learners to compare heart and lung encourages A. Phonetic discrimination. B. Procedural repetition. C. Identifying systemic relationships. D. Legal compliance. 74. Which mentoring technique is most effective for abstraction development? A. Assigning policy summaries. B. Focusing on performance checklists. C. Discussing similarities between complex cases. D. Scheduling silent reading time. 75. To meet regulatory standards, abstraction tasks must be A. Removed from initial orientation. B. Aligned with real-world applications and ethical reasoning. C. Presented as independent puzzles. D. Standardized across all industries. 76. Which is a common sign of abstraction difficulty during training? A. Asking clarifying questions. B. Inability to relate symptoms to diagnoses. C. Strong visual memory. D. Fast task completion. 77. Which technique reinforces abstraction in continuing education? A. Rote recall. B. Unrelated trivia games. C. Group analogical reasoning tasks. D. Speed-based testing. 78. An instructor encourages learners to find connections between unrelated symptoms. This builds A. Memorization skills. B. Anxiety around unfamiliar material. C. Abstract reasoning and synthesis. D. Visual recognition. 79. Why is it beneficial to test abstraction in regulated clinical environments? A. It encourages short-term learning. B. It limits learner autonomy. C. It identifies ability to generalize across variable situations. D. It focuses only on individual recall. 80. Which type of assessment most accurately evaluates abstraction development? A. True-false quizzes. B. Policy dictation. C. Open-ended case analysis. D. Spelling tests. 81. When developing curriculum, which element strengthens abstraction learning? A. Timeline memorization. B. Listing SOPs. C. Incorporating metaphorical case discussions. D. Minimizing peer interaction. 82. Which adult learning principle is key when teaching abstract concepts? A. Passive observation. B. Immediate relevance and prior knowledge connection. C. Uniform delivery methods. D. Elimination of open discussion. 83. Which clinical orientation activity best develops abstraction? A. Chart formatting tutorials. B. Inventory counting. C. Comparing treatment plans for similar symptoms. D. Reviewing floor plans. 84. A mentor provides a scenario involving two diseases with overlapping symptoms. This enhances A. Short-term recall. B. Typing skills. C. Abstract diagnostic reasoning. D. Medication math. 85. Abstraction ability helps learners. A. Remember passwords. B. Focus only on assigned tasks. C. Synthesize and transfer knowledge across cases. D. Avoid ambiguity. 86. When regulatory content is abstracted, it becomes A. More difficult to apply. B. Easier to generalize and transfer into practice. C. Irrelevant to training. D. Legally unsound. 87. What supports abstraction skill development and peer mentoring? A. Top-down instruction. B. Analogy-based reflection and coaching. C. Mandated testing without explanation. D. Policy recitation. 88. A preceptor uses metaphor to explain infection control. This supports A. Compliance checklist fatigue. B. Verbatim repetition. C. Abstract learning and conceptual clarity. D. Linear memorization. 89. The best strategy to assess abstraction in orientation is A. Group presentations of concept similarities. B. Repetitive definition drills. C. Solo reading logs. D. Time-restricted quizzes. 90. Which learning strategy best helps adults struggling with abstraction? A. Interactive dialogue based on familiar experiences. B. Test-only formats. C. Static document reading. D. Strict evaluation rubrics. 91. Abstraction training enhances critical thinking by A. Avoiding unfamiliar content. B. Repeating learned facts. C. Connecting prior knowledge to new concepts. D. Memorizing acronyms. 92. Abstraction tasks encourage learners to A. Focus on isolated facts. B. Reduce real-world interpretation. C. Explore conceptual relationships. D. Skip hypothetical discussion. 93. Which scenario best fosters abstraction during mentorship? A. Listing all medications for hypertension. B. Describing how two diseases impact organ systems similarly. C. Timing vitals documentation. D. Reviewing patient ID protocols. 94. Orientation sessions that support abstraction must include A. Only reading assignments. B. Direct instruction with no feedback. C. Applied reasoning challenges. D. Avoidance of uncertainty. 95. Which cognitive domain is strengthened by MoCA abstraction items? A. Visual scanning. B. Sequential ordering. C. Verbal and conceptual reasoning. D. Short-term attention. 96. Abstraction and orientation ensures that learners can A. Complete forms quickly. B. Follow memorized instructions only. C. Adapt general principles to diverse scenarios. D. Depend only on supervisors. 97. Which activity best develops abstraction and orientation? A. Comparing policy outcomes in various clinical settings. B. Copying compliance forms. C. Repeating emergency codes. D. Memorizing acronyms. MoCA Orientation and Abstraction Test. The MoCA Montreal Cognitive Assessment Orientation and Abstraction Test is a component of the broader MoCA cognitive screening tool, designed to assess cognitive abilities in adults, particularly in identifying early signs of mild cognitive impairment and dementia. The orientation section evaluates an individual's awareness of time and place by asking questions related to the current date, day, month, year, location, and city. The abstraction section tests higher-level reasoning and conceptual thinking by requiring individuals to identify the similarity between two objects or concepts, such as train and bicycle. Together, these subtests assess essential functions like temporal spatial awareness and abstract reasoning, skills critical for independent living, problem-solving, and effective decision-making in daily activities or clinical settings. Here are the top 5 beneficial uses of the sample exam. 1. Early detection of cognitive decline. The test helps clinicians identify early signs of conditions like Alzheimer's disease or other dementias by measuring orientation to time, place, and abstract thinking, allowing for timely interventions. 2. Assessment of executive functioning. The abstraction component evaluates higher-order reasoning skills, helping assess an individual's ability to make connections, solve problems, and adapt to new information, crucial for safe, independent living. 3. Monitoring cognitive rehabilitation progress. In post-stroke, traumatic brain injury, or psychiatric care settings, the test serves as a reliable tool to measure improvements or setbacks in orientation and abstract reasoning over time. 4. Support in capacity and competency evaluations. The test provides objective data for legal or medical decisions regarding a person's mental competency and ability to manage daily responsibilities. 5. Educational and training applications. It aids in developing targeted training or cognitive therapies by revealing specific areas of weakness in spatial, temporal, or abstract reasoning skills.